everyone, it's Veronica, Behavioral Health Director. I'm wanting to provide you with an update as our partners in behavioral health. So as you may be aware, the Department of Behavioral Health is coming back because of the change in the public health order and the reopening of the state of California. We are coming back. We are starting with our clinic sites as well as our field-based services. So that is for direct service providers in our clinics, as well as the staff who have to be there to support them. Our medical assistants, our office assistants, anyone who's needed in the clinic. So that has started now. We wanted to also let you know that if you recall at the beginning of the pandemic, the Department of Healthcare Services, in consultation with the Centers for Medicare and Medicaid Services, CMS, provided county mental health plans and substance use disorder plans with some flexibilities specific to the pandemic while the state of California was closed. And so now it's important that we all know that most of those flexibilities that we were granted for the pandemic will be ending today, June 30th. Some others will be ending on September 30th, and a few have no dates listed. So we will continue to confer with the Department of Healthcare Services and get the information to you. The information notices with the flexibility and dates were sent out to all of you on June 24th by Raquel Ramos. Included in these information notices were some FAQs that provided updates on processes completed during the pandemic, but they were not a flexibility. A few of those included the fact that clients were able to verbally consent prior to receiving services for telehealth, that providers are to ask for a patient signature for receipt of antipsychotic medications, that counties were not expected to obtain signatures on documents for clients that started and discontinued services during the COVID pandemic public health emergency, or who discontinued services during the emergency period. Clients were to date the document when the wet signature was provided, and counties have to document in the beneficiary's medical record the reason for the late signature. Client signatures were not needed on releases of information, consent to treat forms, or NOPPs when the service was delivered exclusively by phone or telehealth, and providers needed to document verbal consent. We will be issuing an information notice or a document that it cites all the information notices within the next week to reflect the flexibilities that are ending and capture updates provided by the Department of Healthcare Services. I'm assuming that because of these changes, the ones that are noted to start in effect July 1, that your staff also will be coming back. I also wanted to alert you to some changes in leadership that we've had here at the county at the Department of Behavioral Health. So Andy Grucci, Deputy Director over Behavioral Health outpatient clinics and our clubhouses, will be retiring on July 30th. We are planning a celebration for him, an after-hour celebration on July 29th, Thursday. And if you're interested in getting information, just reach out to Raquel Ramos and she will send you the flyer with all the information. Also, other changes. Previously, Health and Human Services all resided under one person, that was Cassania Thomas. So she had anything involving human beings, right? Preschool services, children and family services, public health, DBH, and a number of other ones. We were all under her supervisorial scope. That changed July 14th. Cassania Thomas is now the Assistant Executive Officer over Homeless Services. Her new title is Community Reintegration. And so Cassania is overseeing community development and housing, as well as the Office of Homeless Services. DBH obviously has a nexus with homeless support services, and so that nexus continues, but Ksenia is no longer over human services. Diana Alexander, who was formerly a deputy executive officer for the county, and before that she was the preschool services director. She is now the assistant executive officer over health and human services. And so I report up through her. It's just important to know. The Department of Public Health, though, is no longer in Health and Human Services, and for the meantime is going to be reporting through our chief office, our COO, and his name is Luther Snoke. And that is because there's been so many changes in leadership with the Department of Public Health that our COO, Chief Operating Officer, will be the one to sort of assist and get our new Public Health Officer, Mike Sikira, up to speed, as well as to assist with the filling of a new director for the Department of Public Health. Because we have an interim right now who is the COO of ARMC, Arrowhead Regional Medical Center. So a lot of changes happening. Just wanted to keep you abreast of those. Again, please be on the lookout in your inboxes for our IN or information notice, or a document that outlines all the flexibilities that are ending and their dates in which they are ending specifically from the Department of Healthcare Services. And we will also be bringing that up in our ACBO meeting, in our SAPN meeting, as well as on the next in-person contractor provider meeting. So as always, thank you so much for your continued collaboration, for continuing to provide assistance and support to the communities that we serve, as well as to one another. And until next time, I'll catch you on the well side.